So good afternoon. I'm Shaquavi Strong, and today we'll be talking about Black women in healthcare. Um, I have two great panelists with us this evening, and I am so excited to dig into this topic as it is my bread and butter. I love healthcare. I'm currently in public health at Emory, and I am so excited to talk about the experiences of Black women in the field. So, a brief overview. So, we're going to do some introductions and check-ins. We're going to go over the discussion questions I have lined up, open the floor up to Q&A, and then wrap up. I usually start off my meetings by doing a check-in of the participants. So, we usually do green hearts, meaning that we're doing great. We are cash money and everything's going great. We do hearts for kind of we're in the middle. It can be better, but it's not the worst day we've had. And red hearts are for crying and throwing up. So if anybody wants to enter in the chat or unmute or describe their weekend or their day, it is Easter weekend. And so if anybody wants to share, that would be awesome. Green hearts, yay. Love that. Hello, everyone. Thank you for joining. And we'll do touch points in the middle just to make sure we're all doing great, but I'm going to dig right into it. So today we have two wonderful panelists. We have Monet Ducksworth and Andrea Rone. Dr. Monet Ducksworth is a general dentist practicing at the Turtle Creek Dental Care in Hattiesburg, Mississippi. Originally from Pompano Beach, Florida, Dr. Ducksworth completed her BS in food science and human nutrition at the University of Florida in 2004 before earning an MS in biomedical sciences from Florida Atlantic University in 2007. She then went on to receive her DMD from the University of Florida College of Dentistry in 2011. Dr. Ducksworth has been happily married to her husband, Julius, for 18 years and is the proud mother of two sons, Donovan and Logan. In addition to her successful dental career, she is also a major in the U.S. Army Reserve and an active member of Delta Sigma Theta Sorority Incorporated. So, welcome, Monet. Hearts in the chat. Hearts in the chat. Thank you for joining. And Andrea Rome is my Spelman sister. She's a Spelman alumna from Daytona Beach, Florida. She is currently a medical assistant at Georgia Dermatology Partners. In addition, she is currently on the waitlist for physician assistant school. So we have two wonderful people on far ends of the spectrum of the experience, and I think they will bring a wealth of knowledge to our group. So thank you and welcome. Okay. Okay. Great. Now I got it fixed. So my first question. Oh no, nope, didn't. So my first question is, please describe your journey into healthcare, and I will start with Monet Ducksworth.
Good evening. How y'all doing today?
Doing good.
My journey basically started when I was fairly young. All of my family was in the healthcare field, but most were nurses. They worked in the hospitals, and I would just remember being young from Florida. Hurricanes come every summer. My mom happened to be called away to go to work in the middle of a hurricane. Hospitals don't close. Those patients still need care 24/7, regardless of what the weather is. And I knew that that was not for me. I did not want to be in the hospital. I wanted to be someplace that closed, so therefore I could go home and be with my family and rest. I always loved going to my dentist, and that's where my love of dentistry evolved or started. I was fairly young, kindergarten. If you asked me what I wanted to be, it was a dentist. That goal just stayed in front of me all the way through till I got to college. Once I got to college, let's just say my science GPA was not the best. Okay. I had to go to every tutoring session. I had to go to every teacher's office hours to try to get help and assistance because that was just the area that I struggled in. Math, I had down packed, but the sciences, not so much. I actually ended up failing organic chemistry twice. Um, then I finally passed and I graduated. But of course, my GPA wasn't where it needed to be. And even throughout that process, my faculty members saw that I was struggling and said, well, maybe you want to go into a different field. But that wasn't for me. Instead of giving me the feedback that I needed to reach my goals, many were trying to deter me and tell me I need to go into different avenues of healthcare. But I knew what I wanted, and so I stayed focused on the goal. Once I graduated college at the University of Florida undergraduate, I ended up going to the Office of Admissions. So I went to the Office of Admissions at the University of Florida and sat down with the admissions director at the time and said, okay, this is what it is. This is where I am. This is where I want to be. What do I need to do? She basically told me I needed to go on and strengthen and increase my GPA in the. So she recommended that I go and get a master's in biomedical sciences. So I did. While there, believe it or not, the organic chemistry, well, the chemistry department leader at the time called me and asked me to be a teacher's assistant for her chemistry lab. I said, ma'am, did you see my GPA? Do you see that I'm not good in chemistry? And something in me that I didn't self. And so eventually, again, I had to learn chemistry enough to be able to turn around and teach it to somebody else. So that shot up my DAT score that I have to the dental admissions test. It shot my scores up in that. My science GPA went up, and I even got accepted to the University of Florida College of Dentistry early admissions program because I checked all the boxes. I did what they told me to do, and I was able to succeed in that way. So now I am in dental. It wasn't easy. I had a lot of classmates that did not look like me, that had ways and knowledge and background from other students that I didn't have and I wasn't privy to, but I struggled some. But I still had a better GPA in dental school than I did in undergrad. So, and your GPA is not on your diploma at the end. So it was like, let me graduate and let me succeed and become this dentist that I've always wanted to be. And that's just what I did.
Thank you for sharing. I think that is so important, especially that people supporting you, sponsoring you, giving you kind of that trust and saying, hey, I believe in you and I'm putting
Yes,
myself behind you. Because all it takes is some community and support. Thank you for
exactly. Somebody in your corner.
somebody in your corner, exactly. Andrea, please describe your journey.
So I would have to say, I relate a lot to Dr. Duckworth, like a lot. Um, from a young age, I was always interested in gynecology and obstetrics, like just interested in, childbirth and like the way in which, we enter the world. So it was always a goal of mine to watch somebody give birth from like at the age, I was really young, probably like 12, 13. It was always very interesting to me. So I was granted the opportunity when my mom got pregnant with my little sister. And through that, I was able to watch her give birth to my little sister. I cut her umbilical cord. Like I watched the entire process. So from then on, I realized, okay, like, I'm interested in medicine. Like, this is something that interests me. And my freshman year, I decided to be a part of the medical academy at my high school. My mom got pregnant again with my baby sister. She gave birth to her, and I watched that. But that time, I actually like documented everything. I took pictures of the whole entire process, like everything, and I actually used the pictures for a project in the academy. So my interest started very young. From then on, I knew I wanted to major in biology at Spelman, and similar to Dr. Ducksworth, my science GPA was in the gutter. I had to work hard, and I feel like it was a bit. I wasn't able to really pump up my GPA my freshman year at Spelman because I was dual enrolled in high school. So a lot of those prerequisite courses I took while I was in high school didn't weigh into my GPA at Spelman. So I came in taking, the biggest or the toughest science courses from day one, whereas somebody that's a freshman would come in taking chemistry one or biology one. I came in taking like the tougher courses. So like I said, my GPA kind of suffered. But after graduating, I took courses to help um, weight my GPA, like make my GPA higher. And through that, I've been applying to PA school. As it was stated before, I am on the wait list at a PA program currently. So fingers crossed. I currently work now as a medical assistant in dermatology. And through working in dermatology, I've kind of had a change of heart as far as like what specialty I want to focus on. I find a lot of interest in dermatology, and I've learned so much. I would, but prior to working in dermatology, I always just thought like, oh, it's like the skin, like acne, and just the skin. Whereas, I see so many Black women come in with like alopecia and coming to get treated for alopecia and the different treatments that are provided for alopecia. So I feel like I've learned a lot within this specialty, and this also sparks my interest. So yeah.
Thank you for sharing that. I love that you were flexible in pivoting into a different specialty, and that gave you a new perspective and a shift in thinking. So thank you for that. My next question is, did you experience any socioeconomic barriers, such as financial, housing, career supports, community supports, or any biases or discrimination? Those are examples. To having a career in healthcare. If so, please describe your experiences. And anyone can just take that if they want to start and share.
Well, I'll go ahead. As far as social and economic barriers, I can say I was very blessed growing up. My parents had set us up for success financially as far as going to school, but we were still a middle class family. So we weren't poor enough to qualify for a lot of financial aid assistance, but we didn't have enough money for me to just pay for everything outright. So I ended up having to assume a lot of debt in order to make it to where I am now. I promise you, I have a mortgage and a half worth of student loans that I'm still working towards chopping down in order for me to reach this point in where I am. Now, I had classmates that their parents was just dropping checks every semester and just paying for it outright. But unfortunately, I wasn't one of those people, but I made it do what it do. So while I was in undergrad, my master's program, as well as dental school, I worked. I had a side job my whole life, trying to make sure that I can make ends meet. So that's what I had to experience and to endure, but that's just what I was used to. So in order to make sure that I was able to reach my goal, I'm just going to do whatever I need to do to make it happen. Now, were there other barriers and people in front of you that were trying to say no and tell you no? Yes, but you had to keep pushing. You have to, I don't accept no easily. And if you do give me a no, I'm going to ask you why. What else can I do to turn that no into a yes so that we can both come to the same agreement to understand that we are trying to move towards a common ground. So just making sure that you can supplement your back however you need to, like I said, whether that be getting the student financial aid or whatever, taking loans, working another job, etc. Those are just the things that may have to come with the territory in order for you to reach your goals.
Thank you for that. The debt is real. The debt is very real. We can have that conversation offline, but that's real. Andrea.
Yeah, so I have to say, I agree with Dr. Ducksworth. I definitely experienced social economic barriers as far as like financially supporting myself throughout my time at Spelman. It was difficult, but I definitely had a lot of support from my mom. Aside from that, that wasn't like just enough. Like I definitely had to find a way to get scholarships. I also had to pick up a side job when I had time, and a pot of grants and stuff like that to be able to pretty much make ends meet. And I still I came out with a little bit of debt, but considering the fact that I have to go back and I'm going to PA school, I know I'm going to pick up even more. So I'm just gonna have to do it. I'm gonna have to make things work or make things happen when I get into PA school, as well as trying to afford that too. So yeah.
As I always say, debt is already paid. It's above me now, but that is so real. And thank you for sharing that experience because more likely than not, I recently was in a conversation about student debt and how that disproportionately affects Black students and Black women especially. So thank you for sharing your stories.
And then also on top of that, as far as financial and everything, again, now I'm in the Army, in the Army
Mhm.
Reserves, because I came in as a captain and I was already a dentist, had my degree. I was able to qualify for loan repayment through the military as well. And that was just another avenue that I wasn't open to in advance of me going to dental school. So again, some of my classmates were able to go into the military in order to get their loans paid for, actually not have to take out any loans, and they were able to pay for their schooling while they were going through. They had to, of course, owe Uncle Sam a couple years, but once they paid that debt back in time, then they didn't have the same amount of debt that I did that I do at this time. But the military is another way that has helped me be able to afford and be able to pay back that debt.
Thank you for sharing that. I think that's something that people don't know that that's an option. And so that is definitely an avenue that people can take, another resource. So thank you for sharing that. So my next question is, how have you worked to dismantle racism or discrimination within your workplace or within your own practices as a healthcare professional?
I was gonna let Andrea go first. I'll go ahead. So basically, I just continue to be my authentic self. That's all I can do. Is either you're gonna love me or you're not, and it's okay. I've had some patients come through my practice, and because I'm not able to satisfy them in one way or another, I just basically say that I don't believe that I am the dentist for you, and I give you that opportunity to go and find somebody that's better suited to your needs for whatever reason, whether it be I'm Black, whether it be that I'm a female, maybe they just don't agree with my practices. It's okay, and it's okay because there's more people out there that need my help, that want my help, that appreciate my help, and that's okay. When I first started working at Turtle Creek Dental Care, we did have other dentists that were there. One was a white male, the other one was an Asian male, and then there's me. And I was new. So a lot of the patients that were there were looking sideways because now who is this woman? Why is she here? What is going on? But it's kind of like I had to just prove that I was good enough to be there, basically. But again, I was just being my authentic self. There's nothing else that I can do. And it's either you're going to love me or you're not, and you're going to stay or you're not. But I can tell you now that at that same office, now I am the only doctor there. The other two are no longer at this practice. And so therefore, I'm holding it down the best way that I can. But again, there are some patients that chose to leave, but there's a lot of them that chose to stay. And some of them had actually sought me out because I'm a Black female dentist. So however that works on everybody's different levels is different. You may view it differently, or you may be able to handle it on a different basis. But my thing is just stay true to who you are, and then you're able to succeed no matter what, because if nobody else got you, God does.
Thank you for that. I want to ask a follow-up question about, did you experience any like discrimination or biases from providers, from other dentists or other healthcare professionals?
It's very subtle.
Mhm.
Let's say that when it does happen, it's very subtle. It's not like just you don't know what you're doing, you don't know what you're talking about. But it's sometimes I do feel like I have to prove myself, prove my worthiness to be in the position that I am. But then at the end of the day, I've been a dentist since 2011. It's now 2024. Nobody can take that from me. It is what God has for me is for me, and that I'm going to continue to be myself. So trying to compare myself to my other ethnic background colleagues, I try not to do that so much, but sometimes you have to pick their brains, if that makes sense. Sometimes there's things and methods that they may know in their own groups that you have to infiltrate in order to get to the next level. So sometimes making sure that you have that common ground in some way, shape, or form that gets you another foot in the door to open you up to something that you may not have known or may not have privy to prior to.
Thank you for that response. Microaggressions are very real in the workplace, and it's very hard to combat that. So thank you for sharing how you ground yourself in that work. So Andrea, can you describe or explain any work that you've done to dismantle racism or discrimination within your workplace or in your own personal practices?
Yes, I haven't really experienced any like from patients or anything, but I feel like amongst my coworkers, I feel like the way I try to dismantle it is like I kind of address it, but I also like do it in a manner that's not like disruptive to the workplace or like disrespectful to anybody. And also, similar to what Dr. Ducksworth said, just stay true to myself, do my job and do my job well, so that nobody can, have anything to say as far as what I'm doing. But I definitely have felt like I've experienced microaggressions, despite the office that I'm in being extremely diverse. I feel like I still have, experienced some aggressions, and similar to what Dr. Ducksworth said, it's very subtle. Like it's not gonna be like really in your face, like crazy out there, but it's like, like, what do you mean by that? Something like that. So, yeah.
Thank you for that. And I like how you say like you address it in a respectful manner, but you speak up and you try to like settle it there. Um, I think a lot of people feel like that may not be an option because of how it's perceived on you as a Black woman. I just want to thank you for sharing that. So my next question is, what has been the most useful piece of advice, resource, or opportunity that has propelled your career forward?
I guess just being grounded and knowing who you are and whose you are. Again, my faith has helped me stay grounded and to allow me to understand that I have a place where I am. Understanding that there are not people that are going to have your back, so to speak, but then there is a group of people that may, and you just have in with them and continue to grow and learn in your profession. I am a member of Association of Black Women Dentists. They have a Facebook group. We can share cases, share just our experiences, just say that I wore out today. And you have somebody that's going to lift you up and have your back to say you can go on another day. You can make this. I did it, so you can do it too. So having that network, I'm still in contact with some of my dental school classmates. We may have different avenues, where there be private practice, working at a corporate office, those types of things, but we still have a connection based on where we graduated from, and we can still share those experiences as we go along this path, but continuing to just like I said, know who you are, be grounded in who you are, being your authentic self, having that faith base, understanding that you have family around you that can support you, those colleagues that can support you. We have basically another group of Black females that are just in Hattiesburg. And we get together and hang out every now and then, and we don't even have to talk about dentistry. We can just say, "Hey, girl, how you doing today?" just check in your mental health and see how you're doing. So, just making sure that you have people that are around you, that network, that village, that's going to help uplift you and keep you focused, but also understanding that that may be your responsibility to give back to the next person as well.
Thank you for that. I really appreciate that. Just the grounding yourself again, like that is so important, knowing who you are, sense of self, and also having community around you as you try to work out or navigate your career. Literally talked to an epidemiologist yesterday about her experiences and how she stays grounded. And she says, I compartmentalize. I go out and with my sisters and I go on vacations and I prioritize that rest. And I think that is so important. So thank you for sharing. Andrea?
I would have to say the job experiences I've had, and like the the different PAs that I've met, I feel like they've given me a lot of support and a lot of insight on what I would be getting myself into once I do finally become a PA. I feel like that's been really helpful in keeping me grounded and keeping me motivated. And I'm on the wait list now, and this was my second time applying. And if I don't get accepted or get taken off the wait list, it'll be my third time applying. But I've still been I've still been steadfast and still been motivated and pushing through and trying to reach my goal. But I feel like definitely the network I've done with the different PAs that I've met have definitely helped me a lot.
Thank you. I'm always stressing like bullhorning, like community, like find your community, find people who are in the same situation as you so that you can stay grounded in your work and propel through it. So thank you for sharing that. I hope that whoever listens to this recording or sees it takes that and runs with it. So my next question, which kind of segues from that, is how has your personal community influenced the success of your career?
It's another avenue of support. I actually married my husband prior to starting dental school. And he was just an extreme support system for me while I was going through dental school. I mean, I quit many a days, not wanting to go to class, not thinking that I could do it. But he was just there to say, you got this, you here for a reason, let's go. Suck it up, chief, basically. He didn't take it easy on me, and I appreciated that support while I was going through. My mother is another one. She basically wanted to be a MD when she graduated, but she graduated at a time where it was definitely not acceptable for a Black female to be in that type of position. So to see me in that walk of life at that point in time, my mother was an extreme support system, and me being able just to call her at any time, just to say, "Mom," and she just say, "It's okay, baby, it's all right." So just having that family support, somebody that you can lean to, that you can cry on that shoulder and all that good stuff, that won't judge you because they love you and just want you to succeed, is very important. You can do it without it though. Some people I know don't have that family support, don't have that tribe that they want to. And again, your classmates may be that person. So just understanding that you just have to, like you said, find your niche, find your village, and it may not necessarily be in your household, but just knowing that somebody is there for you, whether that be at the church or some other group or volunteerism or something else that you can get associated with. Again, I'm in the Army now, and there's a PT test that we have to take every 6 months. I don't like to run. I wasn't really into exercise, and I was an athlete when I was in high school, but I really didn't do much in college. So trying to get back into that niche. So finding those resources at the gym, finding a coach, and finding other people to work out with. Like, it doesn't even have to be in your field. Like Miss Andrea is going through PA school. It may not be a PA person that is her support system. She may find a niche in a group that's outside of that may be able to support her at that time. So just whatever that is, that whatever your outlet is. I like to sing, I like to dance. I was a member of the choir at church. So any of those types of things where you can get filled up to be able to move on to the next day, just whatever that may be, you'll just find it.
Thank you. I really appreciate your insight. I just want to let that sink in. But Andrea, can you please describe how your personal community has influenced the success of your career?
They've been a huge influence from my mom to my closest friends, even my pastor and first lady back in Florida. Like, they call me and tell me, we're praying for you. We're always thinking about you, we're always praying for you. My friends, anytime I'm calling them, like, oh my gosh, like, it's so hard. Like, I don't know if I can even get in. Like, I haven't even got in, and I'm like, oh my gosh, I'm struggling to get in. Just imagine how it's gonna be once I actually am in school and in PA school. Like, oh my gosh, should I just change my mind and like just go to nursing? And everybody's like, no, like, keep trying, don't change your mind, this is what you wanted to do, so you need to continue to go after that goal. But my friends and my mom and the rest of my family have been a huge influence. My friends know my favorite thing to do is travel, so they'll be quick to be like, okay, let's go somewhere, let's book a trip, go somewhere, do it, do something, get your mind off of it, and just lift your spirits back up, because it does get me down in the dumps sometimes, especially when you're on social media and you seeing like your other classmates like already in their graduate programs, and it's like, dang, am I doing the wrong thing? Am I behind? And it's just like, you have to continue to remind yourself you're running your own race. It's a marathon, not a in the end, everybody has their own story and it's going to work out. So my community do a great job of reminding me of that and grounding me like, hey, you're fine, you got this, keep going. So yeah.
And that, just to add on to that, it's very important that you say that you're running your own race. Again, I graduated undergrad and still took a year off and then did my master's program and then went to dental school. So I was even like 4 or 5 years older than my classmates, but yet there were still classmates that were older than me, like old enough to be my mother, my father, going through this dental program at the same time as me. So just understand, like, you're running your own race. If it's for you, it's for you. Whatever path it may take you on to get you to that pay school from many other folks, but as long as you understand it's your race, then that's all that matters.
I completely agree with the pressure of feeling like you have to have this timeline sorted. I think I always talk about how spelling kind of primes us for success, but also inhibits us with that pressure of doing it in those times. Because I went straight from undergrad to grad and full-time work, and like 0 out of 10 recommend. Don't do that. I tell everyone because they say, oh, I want to do it. No, do not do that. So I also taken a gap year before I do any other advanced degree. But I agree, it is your race and your time, and it'll feel right. You but I'm so glad I took this time off, or I'm so glad I did it this way. But it's all a part of the journey. I say it's for the plot. It's for the plot. So my next question is, if you could change or modify anything about your healthcare journey, what would it be if you can go back? I know we talked about our journey being our journey, but if there's something that you would say, oh, if I had this resource, or if I had this knowledge that I know now, it would have made it easier.
I would say, despite the fact that I was just saying everybody's running their own race and everybody has their own timeline, I would say I would have jumped into getting more hands-on experience sooner. Like, I didn't realize, like, I'm not gonna lie, I was trying to cut corners in the beginning, like, oh, I don't gotta go get a CNA license. Like, I could just get a job, in the hospital doing something else. Whereas like 9 times out of 10, I feel like, I don't know if this is everywhere, but definitely in Atlanta, you're not getting hired if you don't have some sort of training or proof that you've had training in something to be in a hospital, period. And I don't, my, what, 19, 20-year-old self didn't like, that didn't register for me. I'm like, I could do it without having to go. But I put it off, and I finally was like, dang, I really need to get some sort of certification to get a job, to get this experience. And had I done that sooner, I feel like I would be further along. But again, this is all according to God's plan. But that's one thing, if I could go back, I would have I just would have took like a CNA course sooner than what I actually did. So
That's fair. Thank you for sharing. Yeah.
Well, for me, like I told you, most of my family was in healthcare, working in a my mom was actually a medical laboratory technologist. She actually went on to be a professor and the program director for a program in medical lab. And if I could do it all over again, I probably would have taken her course and gotten all of my prerequisites out of the way. Like Miss Andrea was saying earlier, I was dual enrolled in high school. So I did complete a number of courses, but I could have gone to that medical laboratory program and gotten a bachelor's, and also been able to get a trade. I could actually work and make good money. I was in dental school or pursuing my career as I was moving up. So I maybe not have had so much debt. But again, hindsight is 2020, and my race was my race and my path was my path. But that was just something that always stuck out at me because my mom was a program director. I school for 50% off. And then I remember my aunt and uncle saying that they would pay the other 50, but no, I wanted to go to the University of Florida and I was going to be a Gator. And That's what I wanted to do. But now if I could look back, then I probably would have took that 50% off and got that other 50% paid for. But again, it is what it is, and I'm here today.
Hindsight is definitely 2020, but I understand. So, so thank you for sharing. And my last question, I believe, is what advice would you give high school you as you've aspired to having a career in healthcare?
Well, I would say continue to write the vision and make it plain. Um, I guess I kind of did that a little bit when I was in high school. I don't know if y'all had it, but I had a senior book that I had all my pictures in, and it says to write down what do you want to be when you grow up? Where do you see yourself in 5, 10 years? Are you married? Do you have kids? And all that good stuff. And actually, I was blessed to actually look back at that book and see that almost everything on that list that I aspired to be, I checked off. So I would say again to my high school self to write the vision and make it plain, write out your goals and just put it out there in the atmosphere, and whatever is for you will be for you.
Thank you for that. Just plain and simple. You have the vision, manifest it, write it out, work your plan and plan your work, and you got it. Uh, Andrew, it looked like you're still thinking. So,
Yeah, I would tell high school self that trust God's. I would tell myself to trust God's plan. In high school, like I did a lot of worrying about like the future and like what I wanted to be. I was between I don't know, OBGYN. I was really I had a friend that also wanted to be an OBGYN. And then she's like, oh girl, like we were like kind of like, we're both gonna be OBGYNs, like, yeah. And then she changed her mind on me. And I'm like, hold up, what's going on? So then she's like, yeah, girl, I found out about this new profession, physician assistant. You only have to go to school for 2 years and you can be in whatever, you can change your specialty, like if you can change your specialty whenever you want. And she was just really like talking it up. And I'm like, dang. And I'm like, well, should I change my mind? And I was very conflicted with that for some reason. And it was just really stressing me out. Um, Fast forward to now, I'm pursuing that career goal. But that has to do, I changed my mind because sophomore year, um, I changed my mind sophomore year because of what I was going through. But yeah, I just did a lot of stressing at such a young age. Like, girl, what are you stressed about? Like, relax. So yeah, I would tell myself to trust God's plan, and everything is gonna work according to God's plan. Wherever you are supposed to be is where you're supposed to be. And just trust God. Just keep God in everything and walk by faith and not by sight. Trust God and God's plan. Period.
thank you for that. The stressing it don't make no sense. Like when looking back, it's like, why was I stressed out about this? Like I'm here now. Uh, it's just the perspective that you get as you're older. They really do say you do get wiser when you get older. Um, like when you want to be a kid, you want to be an adult, and then when you're an adult, you want to be a toddler. I want to be a fetus. I want to be. I talked to my mom about it last night. I was like, I want to be the egg side of you that was inside of grandma. I want to be there. I do not want to be here paying bills. But again, I'm happy in where I am, and I'm excited, and I am grateful to have heard from you guys, your journeys, and where you are now. So I'm proud of you all. And I would have a Q&A, but the only person here is my mom, and she can text you guys. She can reach out to you guys if she has any questions. But I just wanted to say thank you for joining today. I'm always like pivoting. So right now I'm currently in the National Museum of African American History and Culture. And I tried to find a quiet spot to have this event. So I'm excited. I'm happy that I found it in the genealogy section of the museum, and encourage people to come and check it out. It's so much here in DC. So I just want to say thank you. And I'm gonna close us out with a stop share and a stop recording.